In the last couple of years, following Bernie Sanders' run for president, Medicare for All, the issue of Medicare for All, has become increasingly popular. Turns out people are tired of dealing with insurance companies, rising premiums, these insurance CEOs basically being the middlemen, and they're ready to try a new system, a system called single payer. Now, that system, of course, has been adopted by every other modern industrialized country in the world, but yet for some reason, there are still people out there saying, oh no, but it could never work in America. Nonetheless, that propaganda is not getting through to the people. Right now, 70% of the American people are in favor of it, and health insurance companies, they're not happy about it, and they are desperate to try to derail this before 2020, before Congress, even a progressive Congress or progressive president goes to try to enact it. Now, they are afraid, which is why, along with the corporate Democrats in Congress, they're now unleashing an assault on the whole idea of single payer. Now, this is according to strategy documents obtained by The Intercept and the watchdog group Documented. Now, they say that the private healthcare industry is working aggressively alongside corporate Democrats to spread anti-single payer propaganda and, quote, minimize the potential for Medicare for All as an alternative to the current for-profit status quo. Now, that current for-profit system, of course, is disastrous. Anybody who's under it knows that it's not a system that is set up to help you. It's a system set up to help giant multinational corporations, and actually does it at far more expensive of a price than it does, or than a single payer system would, right? So it's far more expensive, for example, to get healthcare here in America than it does in Canada or the UK. But let me give you more details on who is working on this. Apparently, according to The Intercept, this whole effort is being directed by former Barack Obama and Hillary Clinton staffers, as well as leading insurance industry lobbyists. And look, there is a lot of overlap within those two groups. Oh, those insurance lobbyists get onto presidential campaigns or get into office, and then they go back to being lobbyists afterwards. That's kind of how this horrific revolving door works. And so that's one thing that we need to shut down. Now, those two things together, those insurance lobbyists and Hillary staffers, are getting together in an alliance called the Partnership for America's Healthcare Future. And they tried very, very hard during the build-up to the 2018 midterm elections to convince candidates to, quote, focus on shoring up the Affordable Care Act instead of supporting single-payer healthcare. Now, there were some previous documents as well saying, oh, if Republicans attack it, here's how to defend it, but don't actually do so. Don't defend single payer. Basically, agree with Republicans and say, yes, single payer is bad. It is socialism. And we don't want socialism here in America. We want to fix the ACA, which gives massive amounts of subsidies to health insurance corporations. Now, the principal objective of the partnership's project, The Intercept reports, is to peel support away from Senator Bernie Sanders' Medicare for All legislation, which was introduced with 16 Senate Democratic co-sponsors last September. In terms of tactics, it sounds like they'll just be updating the same lines they used in the 1990s to sideline reform efforts and in the ACA fight to keep single-payer healthcare off the table. That is a quote from Egan Kemp, a healthcare policy advocate with Public Citizen. Now, he's absolutely right. It's just more status quo. It's just more, oh, no, we can't do that because we've got to fix the ACA. But you can't fix the system that was already broken to begin with. And that's what the ACA is. For-profit healthcare is not a symptom of the disease. It is the disease. High premiums are a direct offshoot of that. Again, that is a symptom of the disease. But the disease itself is for-profit healthcare. The system itself is broken. We cannot have a healthcare system that is fair and just and affordable based on profit. It's just impossible. You can't do it. There has to be a system that is set up to where profit is excluded from this if you want everybody to be able to have healthcare. That's just the way that it is. Now, the Partnership for America's Healthcare Future is basically, could be more accurately titled, the Partnership for Profiting Off America's Healthcare. Because that's basically what it is. And that's what Egan Kemp had called it. Now, The Intercept also reported that their campaign, this is how they're going to do it, is basically they're encouraging healthcare companies concerned about the growing popularity of Medicare for All to mobilize opposition among clients, customers, and employees. They want to turn the people against single payer. Now, how are they going to do that? Well, one tactic we've already seen is, yeah, but how are you going to pay for it? I mean, it's just so expensive. I mean, you want to go to a single payer, that's $32 trillion. Where are you going to come up with $32 trillion? Well, we already spend that much on our healthcare system right now. And actually, it would actually cost less to go under a single-payer healthcare system. For example, according to a recent Koch-funded study published in July, single-payer would actually save the American public a total of $2 trillion. And that is the most, not just politically, but also conservative estimate that they could come up with. And still, it ends up saving money. It saves taxpayer money, and it saves people money in premiums. And of course, a lot of people are worried, but they're going to say taxes. And that's the other thing. Well, they're going to have to raise your taxes. Yeah, you raise taxes by just a little bit, but the money people will save in premiums is offset. And you never have to worry about healthcare. You don't have to worry about premiums, co-pays, or deductibles. And that's where it ends up saving you personally money. And it also saves the government money, because when you look how efficient Medicare is right now versus the private health insurance companies, those private health insurance companies have a lot of bloat and a lot of overhead, as well as advertising costs. You can eliminate those by going to a single-payer healthcare system. And so, of course, that gets to how we can fight back against this effort, right? Which, by the way, has been bankrolled by think tanks like the Third Way. Now, the Third Way, right after the midterm elections took place, went onto the Washington Post. And this is what they do. They go onto the Washington Post, they go into corporate media, and they basically go and they slam progressives. They attack progressives, and they attack progressive ideas with ridiculous op-eds. They spread hysteria about the cost of Medicare for All. They use Republican talking points. Not only that, but look, Nancy Pelosi, Dianne Feinstein, both not in favor of Medicare for All. They use those same talking points, and they ask, how are you going to pay for it, when we already know, we've already explained how we can pay for it. So how do we fight back against this? We fight back with truth. We fight back with the facts. We fight back with honesty. We tell the American people, and look, they already know, 70% of Americans already think that this is great. So you counter their propaganda, and you frame this in the right way. And you say, yes, it will be cheaper to pay through your taxes than it is to pay out of pocket for this health insurance, for this for-profit health insurance. These guys are the middleman. They're getting in between you and your doctor and telling you what you can do. As far as waiting lines, there are waiting lines everywhere. That's another attack that they use. There are waiting lines right now. If I called my doctor up today, I wouldn't get in for another 2 weeks to a month. That's a waiting line. And that's with private insurance. So don't tell me that we don't have waiting lines here in America when it comes to our care. We do, and our care is so much more expensive than every other industrialized modern country that has a single-payer healthcare system. Counter them with facts, because the facts are on our side. The economics are on our side. And the only thing they have on their side is bullshit and greed. That's how we win this. that's how they lose, because they are always destined to lose. Medicare for all will happen. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent, progressive media.